Concerning new study from Monash University has revealed thousands of Victorian employees being treated for back and neck injuries have been receiving opioid prescriptions for pain relief.
The high-risk prescriptions are all being funded by the state's workers' compensation system. So to take us through the data, we're joined now by one of the authors behind the study, Professor Alex Collie, live from Melbourne. Professor, thanks for your time on this. So what was most surprising to you about these findings?
Hi, Sylvia and David. Good morning. It's nice to be with you. So we looked at 10 years worth of data from people who had back and neck injuries in Victoria, and we looked very closely at the prescription patterns of people who had any one prescription for opioids in the first 3 months after their injury. And what was most surprising was that 2/3 or just over 2/3 of those people had what we would consider to be a high risk pattern of prescribing. And so they're things such as being prescribed with a very high dose of opioids or a long-acting opioid, which we know can lead to dependence and tolerance, or co-prescribing, so prescribing opioids with other sedating medications.
Wow. Okay, so nearly 1 in 4 injured workers who were prescribed opioids continued using them after a year. Obviously, you described some of the impacts there. Are there any physical risks for having opioid use for that long?
Yeah, so that's the second main finding of this study is that nearly 1 in every 4 go on to have persistent opioid use for up to 12 months after their injury. So they're using it consistently over that period of time. And we have very good data from decades of research in other studies, which really show the potentially harmful impacts of that sort of pattern of opioid use. So, for instance, in Australia, prescription opioids are responsible for more deaths and more hospitals related to poisonings than illicit opioids, things like heroin. And there are other long-term consequences as well. So we and others have published studies showing that people who take opioids over the longer term are much more likely to have long periods of time off work if they have a work-related injury or disease. They're more likely to have things such as bone fractures or changes in their immune system. And some people sort of counterintuitively develop something we call hyperalgesia, which is actually increased sensitivity to pain. So that's kind of the opposite of what you're hoping the opioids do as a pain reliever.
So with all that in mind, why do you think this has become so prevalent in Victoria?
Well, it's not just in Victoria. I think the findings that we're seeing or we're reporting in this paper really reflect what we've seen going on in the community and in our healthcare systems in Australia more broadly over the last decade or two. We have seen high rates of opioid prescribing and opioid use in the community, and there have been sort of multiple efforts by government to try to bring those down, and they're starting to have an impact. We're actually seeing, on average, opioid prescribing dropping a little bit in Australia, and they're things like reducing the pack sizes of opioids, having real-time prescription monitoring systems, moving codeine, which you used to be able to buy over the counter, to behind the counter and only available with a prescription. These have all been efforts by the government to try to reduce the use of opioids and reduce some of these long-term consequences.
I guess, one of the things we must caution ourselves about is that we look at America and the sort of overuse of opioid prescriptions there and what it's done to this to the American population who have been prescribed this. Is there other monitoring systems that we need to put in place here which would limit these heavy-duty prescriptions? I mean, obviously it's on GPs and doctors, isn't it?
Yeah, well, I think we've learned in Australia, we've been watching very closely what's been happening in the United States, where some of the impacts on society over there have just been enormous, as we've seen. We've all watched the Netflix documentaries and seen the movies about that, and the impacts of this can be huge. Australia's been, I think, more on the front foot generally than our counterparts in the US. So we've had those initiatives from the federal government to try to put in place prescription monitoring systems. And in the state of Victoria, we have a thing called SafeScript, which is a real-time monitoring system for prescribers, so for doctors, so they can see what other prescriptions their patients have been prescribed by other doctors more recently. I guess one of the things we're finding in this study is the highest risk, or the most prevalent high-risk combination, was actually opioids prescribed with another medicine. And so we'd like to see those prescription monitoring systems expanded so that they capture those co-prescribing circumstances. And because this study is based in our workplace injury workers' compensation systems, we also think there's an opportunity for the funder, in this case the workers' compensation regulator, to put in place a system-wide monitoring. There's only 1 or 2 states in Australia where that's currently possible, because the data is available in sufficient detail to enable us to look at trends in opioid use and other sorts of healthcare services. And Victoria is one of those states. The other one is South Australia. So we think there is a role for the workers' compensation authorities around the country to take a closer look and to start really looking at their own funding patterns for things, high-risk medicines like opioids.
Well, that's it. They're funding it, so they're responsible for it, aren't they? Just quickly before we let you go, we're almost out of time, but for anyone who is injured, who's suffered back or neck injuries, what are the other forms of pain relief that they could turn to first?
Yeah, we have very good information on this, and opioid use is definitely not a first-line treatment for back and neck pain for most people. The current best practice evidence-based guidelines suggest that staying active, things like massage, short-term pain relief from things such as non-steroidal anti-inflammatories like ibuprofen might be valuable. Exercise can help people to manage their pain. And typically what we find is in most cases of sort of soft tissue injuries for back and neck pain, they're self-limiting, so they get better on their own after a period of weeks or months. A very small proportion of people go on to have longer-term injuries or longer-term pain from their injuries, and those people should really be seeking a good interaction with their GP for ongoing management.
All right, Professor Alex Collie, we'll leave it there, but thank you so much for your time this morning. We appreciate it.